And again, I still feel like there's a gap with public health and pop culture.
Mm-hmm.
There's so many people on the shade room every day, on the comments, and there's an opportunity to even use some of the things that they announce, or even, when John Singleton passed away from a stroke, that's an opportunity for public health professionals to meet or an audience that is greatly impacted by stroke,
Mm-hmm.
and say like, we lost a legend today. Here's what you should know about stroke. Here's stroke awareness. Here are the signs. Again, like there's so many missed opportunities. So that's something that I personally want to focus on, is really bridging that gap between public health and pop culture, because America is all about pop culture. So why don't we just meet people where they are and just, educate that way?
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 38. Hi everyone, Omari Richards here. Thank you all for joining me today. I'm very excited to bring today's guest. I hope that you all are enjoying Black Her Story Month, because we definitely have another Black Her story today, and it's a really great story. I know a lot of you are probably familiar with her nonprofit and the work that she's been doing there, merging pop culture and public health. If you have not, definitely listen to the episode, take in all the insights that she has to share, and go forward and follow her, and just look forward to bringing out all these different things. If you have not as yet, definitely go to thephmillennial.com/public health chat and register to be in public health chats. There will be different times, different days on throughout February. So just check that out on the website. You can just go to my link tree. It's not really a link tree, but a link tree. Without further ado, here's today's episode. Enjoy.
With a public health professional with over 10 years of proven experience in planning and implementing community health programs, fundraising, and corporate social responsibility in healthcare and nonprofit sectors. She has a Bachelor's of Science in Exercise Science and Health Promotion from Florida Atlantic University. She then went on to do her Master of Public Health at Florida International University, Robert Stemple's College of Public Health and Social Work. She is the founder and CEO of the Black Health Commission on Instagram at Black Health Commission, and she currently works as a community health program manager at Advent Health Central Florida. We have Rebecca Desir, MPH. I hope I got your last name correct.
Desir.
Desir, okay. I should have asked you that beforehand, but anyway, welcome to the show.
All right. Well, thank you so much, Amari. This is such a great opportunity. I love your podcast, and I'm just, humbled to be a part of your platform.
Yeah, I feel like it's a blessing for me to be able to tell your story. So I'm glad that we both feel pleasure to have the other person's I guess support. So how are you doing, and how you been coping during this time?
Man, working in the hospital system and starting a new nonprofit during a pandemic has been a lot.
Mm-hmm.
So I think in the past couple of months, I've learned how to cope a little bit better with this pandemic and just managing my time a little bit better, because a lot of us thought that, we're stuck at home. We have a lot more time to watch Netflix and things like that. But for me, it got busier.
Mm-hmm.
So I've been really, really focused on like self-care practices and just making sure that, okay, I'm no longer working after this amount of time. So yeah, so that's what I've been doing to keep myself sane.
Yeah, definitely finding those barriers, especially when work and home life is just one thing right now. Yeah, I completely understand.
Yeah. You're working where you sleep. So it's just like, oh, okay.
Awesome.
Yeah.
So how do you identify, and then tell us a little bit about your personal background?
Yes, so I identify as a first generation Black woman. My parents are both from Haiti. So they migrated here in the 70s and 80s. And then yeah, so I was raised in Fort Lauderdale, and now I live in Orlando. So if you know anything about Florida, there's three different Floridas. There's North Florida, Central Florida, and South Florida. So even moving 4 hours north is like a culture shock. So that's kind of where I'm at now.
Yeah, definitely. The Orlando is no soul flow. That's for sure.
Yep.
What does public health mean to you?
Oh man, public health means so much to me. There's been personal experiences, um, like with my personal health care, as well as my family members and friends, realizing that public health is everywhere. I think a lot of times we think about public health like, oh, it's about healthcare and access to care and things like that. But what I've learned throughout my years in the field is that it's everywhere. Finance, housing, just everything can be public health. And that's what I really enjoy about it. And then yeah, that's what I really enjoy about public health.
Yeah, thanks for sharing that. So you got your Bachelor's of Science in Exercise Science and Health Promotion. So what was your thought process for getting this degree?
Okay, so I did not start off with my
Okay.
bachelor's in that particular major. I actually went to FAU as a pre-nursing student. I wanted to be a nurse, and with the lack of knowledge that I knew about the process, being a first generation, I just thought, oh, you just apply to that one school, and then if you don't get in, then you're just not going to be a nurse. So,
Mhm.
unfortunately, fortunately, because now I really um found my space in the public health field, but with all the prereqs that I took for pre-nursing, the only other degree that would take most of my credits was the exercise science and health promotion. But that health promotion piece introduced me to public health, and I had a professor that just really stayed on me, um, and told me that I should consider going into public health school to get my master's in it.
Okay, so why didn't you want to stay in nursing?
One, because um I did like a few shadowing, and I started really understanding what it mean, and I'm not a woman of routine.
Mm.
I don't like going into work and it's the same thing, even if it's different patients, but I just thought it wouldn't be the best fit for me. And even with the exercise science and health promotion, a lot of students in that program, they typically go into physical therapy. And I explored that for a little bit too. And I was like, I'm so bored. So I really didn't know exactly what I wanted to do in public health, but I knew that I wanted to be in something that would give me, a variety of different things each day I go into work.
Okay, so you were more focused on the health promotion side than the exercise science side.
Yes. So the
Yeah.
health promotion part, I consider myself to be a creative. So just that opportunity to create marketing practices and just educate the masses through that channel really intrigued me. The classes that I took in there, and then I realized, like, oh my gosh, I really like this part of public health. I like to educate people in creative manners, infographics, even memes. Now we're in the era of social media, and I think there's so many opportunities for us to take in health promotion, but that's what really intrigued me.
Yeah, yeah, that definitely does make sense. And it's cool for you to think of like health promotion as a like marketing or like communications kind of base, but it is in a lot of ways. So that is a thought that I haven't had before. So thanks for letting me have that thought, I guess.
Sure.
So you were a registered pharmacy technician at CVS Health. You started this role after just getting into like your undergrad. So uh, did you like need any special training before you became a registered pharmacy technician or no?
Yeah, I actually did. So what's funny is that I was working at CVS I think I was like fresh out of high school. So like maybe my first year of college. And I was a cashier. Then I have one of my hobbies is photography. Noticed there was a availability at the photo lab. And then someone quit from the pharmacy. And then I was like, how can I get into the pharmacy? How can I become a farm tech? So it turns out that Walgreens, as well as CVS, they have these internal farm tech programs. If you're already working there, and of course, if they like you as an employee, they can actually pay for your entire training, and you'll be registered as a farm tech in your home state. So that's the opportunity that I had. And some of my coworkers, they actually went to school to be a farm tech. So they spent about $10,000 to $12,000 to become a farm tech. And thank goodness, I just kind of saw that opportunity and just asking questions like, how do I become a farm tech? Where, how do you go to school for that? And that opportunity came up and I just ran with it. I never saw myself working as a farm tech, but I think that really helped me understand even public health even more, like being behind the counter.
Yeah, it definitely is a different viewpoint. So how long is that training program?
It was about 6 months, but it is self-paced courses. So, if you're just trying to run through the courses and get your cert, because they only give you a certain amount of time to complete those courses to register, because you can't work back there for too long if you're not a registered farm tech. So I try to run through it before the 6 months. And then they even give the opportunity to do the national exam. But by that time, I knew I didn't want to stay in farm tech. So I didn't bother taking the national cert. But it was really helpful for me to have that certification in registered farm tech. So
yeah, that definitely sounds like a very cool opportunity, especially like early on in your undergrad career. So what exactly do you do as a farm tech?
So, I mean, I like to say that we do the bulk of the work in the pharmacy. The pharmacist is really there to just make sure that whatever prescription that the doctor sends over, we're putting in the right pills. They're just making sure we put in the right amount. And they manage a lot of the narcotics. So like the stronger drugs that are back there, and those are locked in a safe. So we don't even have access to that. But checking the inventory of medication, that was our responsibility. When people come in, asking them, what's your name, and typing all of that in, understanding some of the medications as well. That was really helpful because there were a lot of things that I didn't understand going into farm tech that was very clear for me. For instance, like while I was in farm tech, I also interned. I interned at this research facility in Miami, focusing on HIV and AIDS. So there were a lot of people that would come in, and they were taking HIV medication, but when I looked at them, I was like, oh my God, I would never know that you have HIV. So that even shifted my mind on the stigma of someone who's living with HIV or AIDS, and even like just other diseases that I could figure out from the medication that they were picking up, even if it's not for them, but but that was just an opportunity. So that's some of the things that we do as farm tech, and just figuring out what the doctor was writing. But mid career, they shifted to electronic prescription, so that was a bit helpful because doctors' handwriting it's pretty tough to read.
Understood. And so what was the reason that you didn't want to continue on in like farm tech world?
Again, I do not like routine. So so it was once I understood the like what it meant to be a farm tech, I knew, okay, my shift is from 8 a.m. to 4. I'm going to be behind the counter. Like our pharmacist, our lead pharmacist would have everyone in different areas, whether you were the cashier for the day or the one typing up the prescriptions, or you're in the back with him or her, you know, filling in the vials.
Mm-hmm.
So you just kind of knew your schedule walking in. So the only thing that was different was the relationships that I had with some of our patients, and just asking them like, hey, how's your dog? Or, you know, how's your mom doing?
Mm-hmm.
So I'm a people's person. So I think that's what kind of kept me going. But the career, I just didn't see myself continuing that. I would get bored.
Yeah, absolutely, fair enough. So also in your undergrad, you were the founding president of FAU's chapter of Sisters Incorporated. So what is this, and why did you want to found it?
So I went to FAU. It's predominantly a white college, but also realizing that I just always have the need to help and get involved in the community. And I had a friend of mine who was a sister at FSU, and we went to high school together. And then my best friend, she also like she knew that mutual friend at FSU, and we both kind of said like, oh my goodness, she's having so much fun with sisters. I want sisters here. This is great. It's such a great, you know, source of sisterhood on the college campus, because college can be very overwhelming. And so I wanted to create that space for Black women on FAU campus. So started that in 2012 with 13 other women, and it's still there. Like, it's great to see that, oh wow, you know, if I go back to FAU, I can see, you know, an organization, I think they've had more than 8 classes after we've done it, but it's an organization that focuses solely on community service.
Okay, awesome. And like in your answer there, you hinted that you always wanted to be part of like community service, or you were always part of community service. So tell me a little bit about more about that.
Yeah, so I guess I can back up, because I think it goes back to how I was raised. So both of my parents, again, Haitian, very religious. My dad also was a pastor, and seeing both of my parents being so heavily involved in the community and, you know, devoting their time to help others, that was already instilled in me as a child. So when I had the opportunity to understand the world to how I see it, I noticed that there were just a lot of disparities and just a lot of people that need help, but then nobody was helping them. So, so I feel like every chapter in my life, I've always tried to find ways to get involved in the community. So that's really what got me to start Sisters and so forth.
Okay, and yeah, that's a good relationship to have, and I guess a good lesson to teach children to just get like be involved in the communities, especially whatever communities they do get into in life. So that's awesome. So when did you? Because okay, so after this, you got your Masters of Public Health at FIU Stemple College of Public Health and Social Work. When in your undergrad thought process was like, okay, I want to do my Masters of Public Health, or was it? Or did you how did that all unfold?
I did not want to go to grad school at first. I was like, nope. I went through so much in undergrad, because mind you, I had to like switch my major, and it was just, you know, and just the whole process of filing out for FAFSA, I just was like, I'm over it. I was supposed to graduate in 4 years. I graduated in 5. I don't want to do this anymore. But again, thank goodness for my professor that was just always in my ear. And he was just like, oh my goodness, you have such a passion for this. I would help him with research that he was doing as a professor. And he noticed that I really had an interest in public health. And he said, it may not be, you know, research what I'm doing now, but you will find, you know, your specialization, you will figure that out. But I think you should really go to grad school and at least just think about it. So I I'm just thankful that he did push me, because I have not used my exercise science degree at all, but my public health degree has been essential to my career. So I'm thankful for that.
Okay. And did you have any other thoughts of like going to other schools besides like public health, or was it like strictly okay, public health is what I'm gonna do?
I think it's because I didn't really think I didn't want to go to grad school, and just the more that I learned about public health, I'm like, oh yeah, this sounds good. And it doesn't sound like so specific. I think my problem is I don't like to be boxed into one thing, and public health allows us to venture off into different spaces, even if it's health disparities, but you can focus on breast cancer, or you can focus on HIV and AIDS. And that's what I really like about our field. So that's what intrigued me, because anything else, I just felt like it wasn't really a good fit. I never really thought about another major.
Yeah, and I absolutely understand that. And I feel like if people knew about public health a lot earlier on, they would understand that there's such vastness in it, and there's so many different ways that you can mold your career using your public health degree. In your MPH, did you have a concentration?
Yes. So my specialization was health promotion and disease prevention. When you go into the program, you have to take the classes for all 5 of the specializations, well, at least at FIU. I know there's some programs that are just general public health, but at least we got an introduction to epidemiology, biostats, health policy. I feel like I'm missing one,
Social
but
behavioral sciences or something like that.
Right. Yeah. So I mean, we were able to figure that out, and then they even gave us an opportunity to switch our specialization before we got into it. But I felt like health promotions and disease prevention was really my thing, and some of my professors realized that, oh my gosh, you are already looking into like social media. That's something that public health professionals aren't even thinking about right now. So and even right now, I feel like there's still a gap. But yeah, even then, I just, some professors are just angels, they just really find those things that you don't see in yourself, and they'll just encourage you. So I'm really thankful for those professors that kind of help guide me figure out like what I wanted to do. So
yeah, that is great to have. And definitely, so considering that you did have like this interest in social media, and I do also believe that a lot of public health professionals don't utilize social media as much as they need to, and that's a huge thing that we need to change going forward, just considering all the other health fields that do their thing and like a massive out there in all the social media. But regardless, back to the point. So in your MPH, what like was it like a project that you did that you used like social media, where you like just bringing up different like health promotion and saying, okay, let's use social media to do this or that, or what stood out to you there?
So I'll never forget it. So I had a professor, her name is Dr. Biggs, and she gave us the freedom to kind of present something on public health, and everyone was choosing like breast cancer and HIV and AIDS, and I chose booty implants. So I chose booty implants because that's something that we largely saw, especially in South Florida. But then no one was really talking about, the implications of getting these surgeries, and like what happens afterwards, and how that affects your health future on. So my professor was like, oh my goodness, like that's something no one is really talking about. But then, it is a problem. But and then just using, like, I added like a social media piece to it, to like a social media campaign. And then she was like, oh my goodness, like we need to be doing this more. So this was like in 2013, 2014. And even now in 2021, I still feel like we could be doing a better job at just, meeting people where they are too, not having that corporate voice, but just being a little bit more informal. I have, yeah, so I'll probably be rambling, but yeah, so that that was the project that made me realize, like, oh my goodness, there's a gap in, I don't know how I'm gonna create a career out of this, but I really want to focus on it a little bit more.
Okay, that's awesome. That's awesome that you were able to find that, and that is a big needed gap as I see also. So that's great that you are, I guess, you saw it and then you're working to fit into that gap and work throughout it. Are there any other takeaways throughout your MPH program that you wanted to share?
I say like I'm a huge fan of Issa Rae, and there's one interview that she mentioned. A lot of times we have a tendency of working up, like networking up, but we need to network across with our colleagues. And I'm so thankful that I did do that during my grad school years, because even in my college years, like always making sure that, yes, you want to, slide in the CEO's DM or, things like that. But it's also important to, just keep in contact with some of your classmates, because now some of my classmates are working at the CDC. They're working at the Department of Health. They're working, as consultants, and we all can tap each other's shoulder and say, like, hey, you're really good at program evaluation. Can we work together on this? Or you're really good at research. I think that's the biggest piece that I've taken from public health, is that the networking doesn't stop, when you're in school. It's just making sure that you do, create a study group if you need to, and then just also keeping in contact with some of your classmates, because you just never know where life will take you, and you might need to, get their help somehow.
Yeah, that is absolutely key. Definitely networking across, I like, or horizontally. Because a lot of people, I feel like during your MPH, you're always like, okay, let me talk to this alumni, let me talk to this nonprofit CEO or this person who gave me this opportunity. But I think we lose the value in what we can gain and learn from our peers and what they know about the field. Because as we stated, public health is so vast, so there's a lot that you can gain, or just insights from other people and their experiences. So that is a lot of value there. So thank you for sharing that.
Of course.
So after you graduated, you became a health promotions manager at the American Lung Association. So what was the process like for getting this job?
Well, when I applied for it, I didn't even think I would get it, because I've never been a manager before. Mind you, my experience was internships, being a research assistant, being a farm tech. So I felt like I didn't really have the necessary skills. But what helped is that I really like keeping myself busy. And so I would find, internships or even volunteer opportunities to beef up my resume. So although I don't have any paid experience, but those experiences on my resume helped me get my shoe in and at least get that interview. And that was really helpful for me, because it made me realize that I do have these skills. I just never had this position before. And I'm thankful that the staff at ALA saw that in me as well. And they gave me the opportunity to, fundraise. I never fundraised before, but I was actually good at it. Sometimes we're afraid to apply for some of these jobs, thinking that like I don't even meet three of three bullets that they're asking for. But sometimes it's worth a shot, just making sure that you kind of tweak your resume to fit what they're asking for, and you just never know.
Never know. Yeah, absolutely. I definitely think that we do have to shoot our shot and take those opportunities, because you never know which one will land. And also, to your point, we don't know what skills we're good at, or I should say, like, not everyone's gets the opportunity to get like full-time positions where they're able to get those get the experience in those roles, but there are other ways to get the experience, and you should be actively working to get those experiences, whatever way it might be. And it helps you to like talk to those experiences in interviews or like in cover letters or whatever the case might be. So yeah,
Mhm.
definitely a lot of value. Thanks again for sharing that one.
Of course.
So what did you do in this role? So you said you did a little bit of fundraising. What does that look like?
Yeah. So again, I had no prior experience of fundraising, but it's a big piece in the nonprofit sector where you pretty much go around and like beg people for money, you know? So we had signature programs that I would lead. Like there was a lung cancer support group. There was an educational conference that I was responsible for, as well as like other support groups that we had for COPD patients. So I led a lot of our programs for our office in Central Florida. And I also, again, it's not really on my job description, but I kind of fit it in a little bit with the social media. And that was actually, that brought value to my position because most of the people in the office were much older. They understood social media, but they didn't see the value of it. So, I just kind of said, "Hey, can I get the password of the Facebook and our maybe we could start an Instagram for one of our fundraiser events and just taking opportunity when you see it because you all they can say is no." So along with fundraising, writing grants, I had the opportunity to do that as well, and I'm very thankful that I would go to one of these grant professionals affinity groups here in Orlando, and I met a lot of different grant professionals, and they told me about this program where I can get a certificate in proposal writing. And I was like, that's a skill I I think I can benefit from. And they're asking me to write grants at work. Let me see if my, boss would support that. And she said, they don't have it in the budget. I went back to the group and I was like, I really want to take this class, but, she doesn't have it in the budget. Someone from the group, out of his own pocket, paid half.
Wow.
And said, if you can get the other half from your job, or like if you want to find other ways to get the other half, but at least you have half for the class. And I like teared up because again, sometimes what I learned is that if you don't open your mouth and just ask, you don't really like, you're shutting yourself from so many different opportunities. So I'm happy that he did kind of see that wasn't an important thing that I should be a part of. So he gave me half of the money for that certificate, and I was able to apply and like I sat in that proposal writing class, and that has been super helpful. Just learning how to write grants and working with other grant professionals. Again, just like I'm the type, if I don't know how to do it, I'm gonna figure it out. Whether it's DMing people, stalking people on LinkedIn, typing in keywords. Like right now, I have an interest in, diversity, equity, and inclusion. So I'm like, oh my gosh, this is still really new, but maybe I can find someone on LinkedIn that, for an introductory meeting. I think that should never stop, even when you're not in school. Even if you're in the middle of your career, that networking piece should never stop. And that's going back to your point, like just being vigilant about your needs and wants too, because I think it's a partnership
Yeah,
at work.
absolutely.
Mm-hmm.
Absolutely. I feel like definitely networking because you're just learning, especially in the field of public health. There's just so much learning to do because things are always changing. So just having that open mind to learn is so important. I wanted to ask you, how did you find out about the Grant Professional Affinity Group?
Yeah, so there's a I don't know if it's in every city, but there's a group, well, an organization here that partners with one of the local colleges, and it's called the Edith Bush Foundation. And they're pretty much the nonprofit hub for resources and classes and things like that. So if you look, you know, look into that in wherever you live and see if there's like any grant professionals groups or even association for fundraising professionals, like all these professional organizations or groups that you can join, especially if they're free or if they, offer some free events. I would say just go for it, take advantage of that, because you never know who you're going to meet. And then I think a lot of times I would say, oh, that's like, I don't know how to write grants. I won't need to know how to write grants. But then being open minded to at least take those opportunities. And now it's like super helpful to know how to write grants.
Yeah, I could imagine.
Mhm.
So after this, you were, well, I don't know, this might be during the same time. You were a volunteer for the events chair for Central Florida Urban League Young Professionals. So how do you come across this, and then what did you do?
Yeah, so I have always been an Urban League baby. Like I've been in Urban League since elementary school. And when I moved, and Urban League is a social service organization that focuses on workforce development, and it was founded by Whitney M. Young. He focused more on like he was part of the Big Six, which is the group of men that walked alongside with Martin Luther King to, push a lot of policy for the betterment of Black people in America. So he was part of that group, and he founded the Urban League, but their focus was primarily in getting Black people into these corporate jobs and all of that. So he was a pivotal leader in that time. And so he started the Urban League, which again, I was a part of since elementary school. And then when I moved here in Orlando, when you don't really know anyone in the city, or you don't know where to start, I just went to what was familiar for me. So I found the Urban League and realized that they had a young professionals group that I was a part that I became a part of. And then after a year of being a member, I um I applied to be on the board for events and PR. And again, tying back with social media, again, always trying to find those opportunities to hone my skills on that. So helping with a lot of the event planning for the young professionals group, whether it's like a happy hour, or even if it's like providing a panel, like a space for like elected officials to come in and talk about policy or what's going to happen in the next election year or whatever. Like it's just so many opportunities. And again, it was another space for me to network and meet other people in a new city. So I was really thankful for that too.
Okay. Yeah, that is awesome that you were able to say, okay, I know what's familiar. Let me see what groups they are out there, and let me connect with those people that know, like, have similar interests as I do. So that's a good way to think about it. Um,
Mhm.
so after this, you were a consumer health educator at Strategies Now Incorporated. So how did you get this position?
Yeah, so I actually they sent me a message in LinkedIn.
Hmm.
um the CEO actually did, and reached out to me and said, I love your background and your education. I think you'd be great for our team. And so I like did the interview and met the rest of the team. And then about a week and a half later, I, got the position. And I was working there as health educator, focusing more on educating people who suffer from essential tremors. Um, it's a neurological condition that affects, a person's hand. And so sometimes even when they're sitting still, they might have tremors and you just see their hands shaking, or sometimes even their head can just be unstable and is shaking often. So we work together with another organization that provided treatment options too. So not only would we educate them on their tremors, but connect them with like treatment options to see, you know, if they would be interested in what was offered. And then again, there, you know, just trying to learn my social media skills because that's what I'm interested in. And there was like a weekly Facebook show that one of the directors did, just an educational talk show. And I volunteered to help her. Like I would stay late to help her figure out like, well, okay, so how do you do this? How do you get the camera to look like, you know, just asking, just being very curious, and to the point where she said, you know what, you have a natural interest in this. Do you want to help manage like the comments as I'm going live? And I'm like, yes. So so again, like, you know, asking questions, making myself available, that opportunity presented itself. And then I was able to help with not only that, but even a newsletter that we started creating to spread out, you know, information and educate some of our patients too. So all of those skills, you know, building up has helped me. Like I felt like I just accumulated skills with each position or internship that helped me with the next position.
Yeah, and you also were very proactive in wanting like new experiences, or getting involved in things that interest you. So that is a great tip there also. And also I would say everybody should update their LinkedIn, because you never know when a CEO is going to reach out to you to
Yes.
to ask you to be on their team.
Yes. And I would even say, you know, I know you can do whatever you want on your social media, but I feel like now that I've been focused more on public health on my social media, even opportunities there has been, you know, popping up. So I think just making sure that your digital footprint is very clear, and you're creating content under your name. So when you Google your name, you see that Amari Richards, this is all your, you know, your podcast articles that were written by you or research that you was a part of. We have to create our own digital footprint. So when someone looks you up, it's not just your Facebook and your LinkedIn, but it's like tons of information that people can gather, you know, what you do and who you are just by what you've produced online.
Yeah, I absolutely agree. I feel like everyone has a personal brand, even if you don't do anything, that is part of your personal brand. So it's better that you take a proactive role in building that personal brand and do those things. And one thing that I do is actually have a Google search on for like my name. So if anything new comes up there, I like find it. But yeah, definitely Google your name, check and see what comes up there, and see how you can build other things to benefit yourself. Because if you type in Omari Richards now, you're gonna the Public Health Millennial Career Stories podcast is probably the first thing that's going to pop up, which is just pretty cool to know. You know?
Yeah, it's pretty awesome.
Yeah.
Yeah.
Then that, and as you said, like I've been doing this, and like people have reached out to me that I would have never thought reached out to me. People asking me to like speak at for students. I've been asked to like do this lecture for UF School of Public Health. Undergrad school. So it's been really fascinating just putting yourself out there. You never know what comes. So I would definitely just advocate for everyone, especially in public health. Like we need more public health students, professionals online. So get out there and make your profiles, everyone.
For sure.
So during the same position, you were also on the board of the Greater Haitian American Chamber of Commerce. I know you were on this for just a shorter period of time, so you just want to talk a little bit about this.
Yeah. So again, just trying to network and figure out my position in this new city. I got involved with the Greater Haitian American Chamber of Commerce. One, because I mean, I was with people that look like me, and I was like, oh my gosh, I'm Haitian American. Let me see how I can help this community in particular. And that was interesting because I've never been part of that side of things, economic stability. And it goes back to my point where public health is so vast. And although it was a chamber of commerce, I realized there were some points where, oh my goodness, this is connected to public health. The chamber of commerce is promoting all of these business on behalf, just trying to get them more clients. And then this will later help them, feed their family, and then they won't go hungry. Like, I literally go into these rabbit holes because I'm like, oh my gosh, if we just help them promote, they're a mom and pop shop. So, like, as I said, public health is everywhere. You just have to really hone down and just realize that. But yeah, so my tenure there, it was short-lived, because then I started like a new job not too long after, and then I just felt like I wanted to commit myself more to my career. And then, like, once I get my career going to where I want it to be, then I can kind of go back to volunteering my time. So
Okay. And how does one get involved in the like a chamber of commerce?
yeah, so sometimes they have like board applications available, and then they have open positions that you can apply for. um Even the Edith Bush Foundation, even if it's not a chamber of commerce and you just want to be part of a board, you can even put, open to be part of a nonprofit board on your LinkedIn. That's one of the options that you can do. And the Edith Bush Foundation, if you find a similar organization in your hometown or wherever you live, they also have an option where you can see some of the local organizations that are looking for board members. So being a board member is, well, depending on which stage the nonprofit is. If they're in the very beginning, you're going to be a working board member. You're in the trenches with that founder and CEO. Or if they're, in middle aged or they've been here for a while, I think those can be very beneficial too, because again, it's networking, and then you get to be in the room when they are making those big decisions, whether it's budget or programming. Again, learning a lot of those skills, being on the board. Because I think being on the board is not just helpful for the organization, but it should be helpful for you too. Like, you should go in there with a goal in mind and say, I don't really know much about fundraising, but I feel like I can do it if I'm given the opportunity. So you just never know. So going into it, always thinking like, this has to be mutually beneficial. Is it you just want to beef up your resume? That's not going to be helpful in the long run. But just thinking about maybe some skills you want to learn while you're being a board member, I think that's going to bring value.
Yeah, and that is great advice for anyone thinking about being a board member. And I did not know that you could put on LinkedIn that you're open to being a nonprofit board member until like I looked at your profile and I was like, oh, because at first I thought that you were trying to get people into boards, but then it made sense. Okay, she's open to being a board member, which makes sense. Okay, that's cool.
Yeah.
What else can you do on LinkedIn if you know? Like,
Um, so many things.
okay, you don't have to tell me if you don't know.
No, I'm just trying to think like what would be helpful,
Mhm.
especially for this particular audience. I would say invest time in that area where you can like type up a summary about yourself.
Mhm.
Um, because your resume can only say so much, but your LinkedIn is really your professional career. You can put everything that you've done, boards that you've been a part of, volunteer interests, all of that can be on LinkedIn, and just making sure that it's very clear like who you are, what you're involved in, because again, your resume is just text,
Mhm.
you know, but your LinkedIn, you can add videos, you can add interviews, podcasts, once this is over, I'm putting this on my LinkedIn. You know, once you provide the link, it's just, it can be so much more. And then you can create your own content. If you're a blog writer, or if you're into just, you know, writing statements about certain topics that interest you, you can do that. You can join groups that is of interest to you, even if maybe you don't really have the experience, but maybe you just want to be a fly in the room and just kind of gather some information, or maybe even network with someone that you see in the room and you're like, oh my goodness, they really know their stuff. And I looked on their LinkedIn profile and oh my gosh, that's exactly what I want to do next. So again, just really dedicating time to beef up your LinkedIn profile, make sure that it encompasses everything that is of value. And then, you know, if you want to do blogs, you can, but also joining those rooms, those groups are helpful too.
Yeah, definitely. Thank you for those that advice, I should say. And then you were a program manager at the Central Florida Urban League after this. So how did you get this, and what did you do?
Yes. So, I again, Urban League has my heart. So I had I actually got laid off at Strategies Now. So the organization that reached out, they had to lay off the entire department. There was no longer any funding. And that was heartbreaking. That was really sad. I was very sad, depressed even, because I realized that I put in a lot of stock on my career, and I realized like, oh my goodness, what am I if I'm not working? Like, I need to really figure out who I am, because it was a lot of value into like what I'm doing. And then anyway, that's like another topic, but that really opened my eyes. And my mentor, you know, he was the CEO. Well, he still is, but he's the president and CEO. And then I asked him, I was like, yeah, I'm in a bind. Like, I don't know. I'm up here by myself. My family's somewhere else. I need to figure out what I'm going to do. And so he said that he actually has a position that's opening up. Would I be interested? And he knows that, you know, this is not a long-term thing for me, but is it something that I'd be interested in? And I'm like, yeah. So I took the opportunity, and it was just so great to give back to an organization that has given me so much. So that was such a great time in my life, being able to work, you know, see the kids that are benefiting from the Urban League program. And I'm like, oh, that used to be me, you know? So yeah, so I worked there. And then because of my relationship with my boss, once another opportunity came about, it was kind of like, oh my gosh, thank you so much. But, you know, I have to go. Again, I think I'm like, as I'm talking to you, I'm realizing like, oh my goodness, it's really, the support system is so valuable, and not being afraid to say like, yeah, I need help right now, or, you know, or I don't know what to do. Like, being vulnerable enough to share that, I think that is very helpful.
Yeah, absolutely. Definitely thank you for sharing that. I do want to go back to like you getting fired and you figuring out that okay, I put so much value into like myself as my work or my job that I'm doing, and you learning that you didn't have that job, so now I guess you're like questioning like what am I, right? I guess. So talk about that.
I just I just thought, I go to school, I graduated with my master's degree. I shouldn't be in this position. Like, it was just such a traumatizing time for me too, because it was just everything that my parents taught me. It's like, I did everything right, and like, they fired me. Well, how am I going to get paid? Where am I going to get money from? And then it started made me think like, oh my goodness, I put so much stock into my job, my career, and then not even making time to hone on my skills. Because there are some things that, you know, I started thinking like, oh my gosh, you can write grants, it started making me get more creative. Like, how can I establish myself outside of my career? So even if I don't ever want to feel obligated to a job, and always, making sure that I'm working on pieces to even sustain myself, even if I would lose my job, making sure that I'm saving enough money if that was to ever happen again. There's a lot of people that lost their jobs in this pandemic.
Mm-hmm.
And that's a shocker for a lot of people, because you would think these huge organizations have so much money in the reserve, but it's not true. They ran out of that like 2-3 months of the pandemic, and they had to let go. Like Disney let go a lot of people. Imagine that. So I think this pandemic has been a reminder of that for a lot of people, that you really need to figure out some other streams of income, because everything is not certain. But at that time in my life, that was what I needed, though. I needed that to happen, as much as it hurt at that moment, but that needed to happen for me to understand that you are more than your job, and you need to get involved in the community more, figure out what do you bring to the table, what's your personal brand, how can you sustain yourself when you don't have a job.
Mm-hmm.
So that got me into the entrepreneurial road.
Yeah, and I definitely understand like that feeling, that thought process, because like I was in meetings with my coworkers when I was in Alaska, and they were like, "Oh, this is the job that you're gonna have." Like they print out the entire like job description, and then like the pandemic came. My boss she switched off the job and went into consulting, and just my position just wasn't a priority anymore. And there's like, okay, I gotta like completely like just change up and realign and start looking and applying for jobs. And that wasn't something that I was planning to do, because like even before I got there, they're like, oh yeah, it's going to be a position for you to work into if you want to go full-time afterwards and whatnot. But life happens, and I have that same reality. It's like you definitely have to, of course, like I love the work that I do, I love the jobs that I do, but I do want that like financial back into and just like security to do other things and have something that is more than just my job. Because I definitely, like, especially now, I hate to be put in a box. I feel like there's so much that I do as a person. So yeah, I don't know, that just resonates with me a lot.
Oh
So.
yeah, no. And what you said resonated with me too. I think putting ourselves in a box, that's a hindrance for our growth. Just always being open to other opportunities. And I think this podcast is a great avenue for you to network and, meet other people, and then even get paid. People, it's $1 billion industry. So again, I'm just glad that you're venturing out on your own too.
Yeah, absolutely. I have to build our personal brand.
Yep.
So after your short stint at the Urban League, you moved into a full-time position as a community health program manager at Advent Health Central Florida. And this is the current position you have, I believe, correct?
Yeah.
Okay. So
I love it.
Yeah, how do you come across it, first of all?
Okay, funny story. So I applied for this position, like a similar position with this system 3 years ago. No, wow, 4 years ago.
Mm-hmm.
When I was at American Lung, and I did not get it. I did not get it at that time, but I stayed in contact with the hiring manager. It wasn't like super consistent, but we, nonprofit, because this hospital is a nonprofit hospital as well, but the nonprofit sector runs really close. So even if I might not see you at one event, but I might see you at a conference. So I ended up seeing him at an opioid conference for the city. I was like, oh my God, hey, it's been a while. How you doing? And he was like, hey, I need to touch base with you because there's an opportunity that might come up. And I'm like, what? Meanwhile, I've been applying to this hospital system since I was in grad school in Miami. Like, I've always wanted to work in the hospital.
Mm-hmm.
I feel like it's very neat to see how it all comes together. So yeah, so I mean, it happened pretty fast after that. Did the informal interviews, met with his boss, and I've been here almost 2 years. May will make 2 years.
Okay, yeah, and that is awesome. That's not a typical story of someone getting a job, but as you said, they got to build those connections and like just keep those relationships alive, because you never know, especially with the hiring managers. You never know what's gonna come up.
Right. I am so big on that. I'm so big on just keeping in touch. It doesn't even have to be as often as you talk to your best friends, but even if it's like an article that you saw of their organization, it's like, oh my goodness, this is so neat. You all are, going into this space, and let me know if I can be of assistance. I work here now, just something. And then that'll keep you top of mind when an opportunity does come.
Yeah, and I definitely think that value proposition and asking how you can be of service or how you can help is always important as well. So,
Mhm.
so what do you do in this current role?
So much. So, so I help with the community health needs assessment. So nonprofit hospitals have to do community health needs assessment every 3 years. So I assisted with that. And then once we figure out the priorities from the needs assessment, we then put together a community health plan for each hospital campus. So assist with that.
How many
And then
hospital campuses are there?
in our division, there are 17.
Okay.
But I'm not responsible for all of the 17.
Okay.
We broke them, like each individual in the team has like a certain amount of hospitals that they're responsible for. But then there's also part of my job where it does encompass the entire division, like community benefit, which is I don't want to get too into it, but all of these tasks that I have to do for my job, they all come together. Like we put a report together, we send it off to the IRS. So these are all IRS mandated tasks that the hospital has to do. But you know me, I found a way to get like some marketing and health promotions into it. I realized that there was a gap in our department, and I said, wouldn't it be neat? No one's reading this 700-page community health needs assessment. Wouldn't it be neat if we just make it a one-pager, and people can just get a quick snapshot of what the priorities are? That'll be helpful for our CEOs. I made my case, and then now I've become like the infographic person, which is pretty cool. But again, it's just, always being proactive and seeing like how can you bring value to this team or to this position, and that's what makes you priceless to the team, because they're like, oh, this person is very committed, always looking. But it's not just for the organization, but even for you, like, adding onto your skill set, because you always have to look at, even though it might be outside of your job description, but even if you can take just one little thing and say, you know what, I noticed that our department is missing this, or I noticed that, we can streamline this process a little bit better. That's bringing value, and that makes you indispensable. So
Yeah, agreed. Yeah, definitely looking for where you can bring value, or just seeing where things are, especially when we have the outside perspective. It could be easy to see, okay, this process isn't working as best as I see it could be, and speaking up and advocating for those changes. So yeah, that's awesome. Thanks for sharing that. So you are the founder and CEO of the Black Health Commission Incorporated. So what made you want to start this?
Okay, so being that I've been in all of these spaces, and with my personal experiences, I realized that a lot of people just look at health, again, access to care, primary care physician visits, insurance, all of that. And I'm like, that is not, that's not what's going to help us, that that's not even the root cause of why they don't have insurance. Maybe they can't afford insurance. Maybe it's because they have a minimum wage job. How do we address, I go into rabbit holes. So Black Health Commission, I started that technically in 2019, but got all the paperwork and things like that done last year, and then got our 501c3 status late November. So it's fairly new, like legally, with all the paperwork and things like that. Have a strong board who supports everything that we do. We're pretty active on Instagram. It's Black Health Commission, and I try again to educate and tie in a lot of those pop culture pieces, even if it's like a TikTok dance, but tying it to, health. Because even I think there's like a June bug challenge right now, but just I posted a video, but then in the caption I said, it's always important for us to find moments to cultivate joy, because there's just so much going on, tying it with mental health, and that way people can see that again, everything affects your health, but how do we make it, how do we bring it to layman's terms? I think that's the best way that I can describe it, because a lot of times us public health professionals, we try to describe a lot of these things at a high level, but to the common person, okay, why should I care? Like, like you have to find creative ways to get people to care about things, and then they'll realize, like, you know what, it is important. You know what, this has been a heavy year and a half, or we haven't really had moments to go out and do what we typically do. So how do I cultivate joy while I'm home? So just always finding creative ways to partner with even other folks on social media. And then now we're also doing an upcoming event called like the Black Dollar. It's a virtual pop-up shop, but again, finding those unique events, and how do I tie a virtual pop-up shop to health? So I tied it with economic stability. That's one of the social determinants of health, and realizing that, okay, if we support these Black businesses, especially during this time, like pandemic, no one's really going out as much. I can't say the same for Florida because everything's been pretty open. But, when you go to other places, dining is still shut down, so it's very different based on the state you're in. But again, just going back to that event, how we can still virtually support each other, and how do I create a space to then help these businesses sustain themselves during this hard time. So that's really the focus with a lot of our events, just always finding a way to tie it to like the root causes, like the social determinants of health. So
okay, thank you for sharing that. So quick question, how many board members do you have?
I have five board members.
And did you start this like just by yourself, or did you have anyone else that you started? Okay, so you started by yourself. So what did you always want it to be, a nonprofit, or what was the thought process for that?
So I always knew that the impact that I wanted to make is either a social enterprise or a nonprofit, but I knew that my heart is just giving back and understanding that, okay, I've been working a nonprofit for over 7 years now. I have an understanding of nonprofits, so I felt like, okay, I know how to apply for grants as long as I get a strong board, and I can build from there. So that was really my thought process with starting the Black Health Commission, just understanding that there's a gap, and applied for the 501c3 and then got that.
Okay. And I guess currently, is there anyone else that works at Black Health Commission besides yourself and the board?
No. So I will tell anyone that is trying to like start your own business. Yes, you might find people to help support you. My board is amazing. We actually have a board meeting tonight, but it's also just checking yourself and realizing that, you know, for you to be an entrepreneur, you really have to dedicate time to get better at that, or being able to find those grants, because a lot of it's not easy. There's some times where I'm just like, oh my god, I just worked, you know, a full day for the hospital. Now I need to, you know, dedicate some time to look for grants, or I need to dedicate some time for our social media. And in the beginning, it's going to be very difficult, but you know, you just have to kind of buckle down, because that's what you sign up for. Our, like, especially social media kind of praises entrepreneurs, but don't really talk about, you know, the ugly side of entrepreneurship. I know there's some friends of mine, even photographers and other people who take in different routes. The story is still the same. You know, it's a lot of work to get yourself to where you want to be in order to sustain your organization or your business. But a lot of times people want to skip that hard work, and just get to the bag, you know, where the money resides, you know, like what they say. But you can't skip that part. Like, there's going to be times where you sacrifice. I mean, thank goodness it's a pandemic, so I don't have too many reasons to go out with my friends right now. But imagine if, you know, everything was open. And again, I think that's another thing that I think I think for this time period is that we're in a pandemic, so it kind of forces me to stay inside anyway. So that gives me a lot more time to focus on like the other things that I want to do, like consulting. I want to get into that, like the Black Health Commission. That's going to take a while for it to get there. They say it typically takes about 5 years, you know, for you to see a business to be up and running and sustainable. So just being patient and again, putting the time in. Like, it's not going to be easy.
Yeah, I think those are the two key words there, like consistency and patience. Like just being
Mm-hmm.
consistent and patient with what you do. Just consistently be patient and patiently
Mm-hmm.
consistent. I don't know.
Oh yes. Yeah, I like that.
Yeah, so that's awesome that you build this out by yourself, and that you put aside that time. I know that you had to dedicate it to build this thing. What was the process like for selecting board members, and how do you go about doing that?
So I relied a lot on like informational interviews from people that I know who have done it before, whether they have started their own nonprofit or maybe an executive director that I knew, to figure out what would be the best process. So I started first. I started putting it on our Instagram and saying that, hey, we're looking for board members, and I would always use we in my comment. Even if it's just me, I always respond like, we thank you so much for sharing. You know, I'm just getting into that mindset because I'm like, I'm manifesting a staff. It's going to get there. So so yeah, so if you follow Black Health Commission and you see yeah. So anyway, yeah, so I, you know, started publicizing for that, then went through a whole interviewing process, scheduled time with each person who applied for it, and then went through the interview, you know, their application with them. As in the application asks, well, why do you want to get involved with Black Health Commission? Have you ever been on a board? What skills do you bring to the table? How can BHC help you with some of your goals? Because again, I always think we miss the mark sometimes when we asking people for help, but then not asking, well, how can I help you too? You know, this has to be mutually beneficial. So those were just some of the questions that I had in the application, and it was a process, but I'm glad with the board members that I currently have. So again, they're just awesome.
Okay. And when you did pick the board members, did you like select them based on, okay, someone has like financial strength, someone has like programmatic strength, and what are those types of areas or expertises that you wanted on your board?
Yeah, so we're actually still working through that strategy too, because we are still a brand new board. And there's some things that I thought, oh, we don't really need that now.
Mm-hmm.
And even skills on strategic planning, you need someone who's really good at that, because a lot of times people think running a nonprofit is, oh, you're doing everything for free, but no, it's a business. Like, it's still a business, still have to report, expenses and what happens in the organization. So again, there's some skills that I have overlooked, and I'm learning from those mistakes. So probably going to ask for, probably going to put another ad out by end of quarter 2 of this year, maybe, and then just try to get some other board members for some other skills that we missed. But that's where we're at now.
Okay, definitely fair enough. And do you have an advisory committee by chance or no?
No, but that is a good idea. I probably do need to just focus on maybe advisory committee. We do have committees that we're building just to get people involved, because a lot of people who follow us on Instagram, they're always asking, how do they get involved if they're not in Orlando?
Mm-hmm.
So just trying to find creative ways to make people, you can get involved with us, but here's how.
And what are some of those ways people can get involved if they're not in Orlando?
Yeah, so some of the ways, so we're putting together some of the committees, whether it's like community outreach or if it's marketing. That's a huge piece that gets overlooked. It's a lot to run a social media account, and just making sure that your content is pure and all of that. So just making sure that we get those committees filled.
Mm-hmm.
And then some of them you don't have to be in Central Florida at all, or even, we're still doing virtual events. So that's another way that you can support Black Health Commission. Just check out the page and then check out the Linktree link, and you'll see some other ways that you can get involved as well.
Okay. And what are the hopes for Black Health Commission going forward?
Well, since I started on, like, I've built the Instagram. Now it's like over 11,000 people, and obviously they're not all from Orlando. So I can see Black Health Commission being a national organization that provides health education and historical context behind a lot of things that we think, oh, that's just the way it is. But then when you dig a little bit deeper, even tipping, like, there's a racist history to that.
Yes, yes.
Right. It's just like so many things. It's like,
Mm-hmm.
what? They created this system. And, it's just like so many things that are mind boggling. And I'm so glad to have this platform to educate. And then today, like, I posted, the Black Panther Party's contributions to public health.
Mm-hmm.
They did like the school breakfast and lunch program. They started an initiative for sickle cell disease. They started free clinics, like, with little resources in Black communities in California and other places. It's just all of the history. We can learn so much by learning our history. So again, that's another piece that Black Health Commission does as well, is just to spark that idea. Even though we may not be the person to do everything, but if you jump on our page, that can be a spark and encourage someone to move that forward. So even though we're doing the virtual pop-up shop, or a festival to raise funds, or mentoring, like, we want to do that as well, providing mentorship for any students who are interested in healthcare industry jobs. So it doesn't have to be like doctor or nurse, but even public health professionals as ourselves. But the opportunities are endless, and it's ever growing. I feel like a lot of brands do rebrands a lot of times. They change their look at Dunkin' Donuts. Now they're just Dunkin', you know? So I'm being patient with myself with that too, that I don't have to figure it all out right now, but that's where we're at now.
Okay, awesome. Well, thank you for sharing that. Where would you like to see yourself personally in the future?
I see myself traveling, speaking engagements, consulting, on these health, these digital marketing campaigns. I really want to get really good at that. And again, I still feel like there's a gap with public health and pop culture.
Mm-hmm.
There's so many people on the shade room every day, on the comments, and there's an opportunity to even use some of the things that they announce, or even, when John Singleton passed away from a stroke, that's an opportunity for public health professionals to meet or an audience that is greatly impacted by stroke, and say like, we lost a legend today. Here's what you should know about stroke. Here's stroke awareness. Here are the signs. Again, like there's so many missed opportunities. So that's something that I personally want to focus on, is really bridging that gap between public health and pop culture, because America is all about pop culture. So why don't we just meet people where they are and just, educate that way?
Yeah, absolutely. And that's definitely like conversations I've been having with a bunch of like public health professionals, like talking like people who talk to like health departments, like why are they so behind in like the social media posts? And then because I know that there's like Denver Public Health and John Hopkins, I think University Public Health. They have like two Instagram profiles that are really like pop culture heavy. Then they do a really good job. But the rest of them are like, I don't know where they are.
Do you remember? Did you see this ad? Maybe it was John Hopkins or maybe Emory. I can't remember, but it was a public health school, and the kids kind of put together this song. I think it was like "Put Your Mask On," but it was based off the WAP song.
Yeah. I think that's probably John Hopkins.
But that's what I mean, though. You know what I mean? Like bridging that pop culture that brings attention.
Mm-hmm.
The message is still being said, but maybe in not the normal way. And that's to my point, just bridging pop culture with public health. I think that's where we'll meet a lot more people where they are.
Yeah, absolutely, and that definitely is the future that I want to see for public health too. Just being more accessible and engaging in different media platforms, especially social media, as it is one of the biggest platforms that we all use today.
Yes, for sure.
Yeah. So moving on to the last part of the show, the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say it's the theme from our conversation. Please do not put yourself in a box. Even if you are just so sure you want to do breast cancer, but like there's just so many avenues you can take with breast cancer. Just don't put yourself in a box. You never know what you're good at until you try it. Just give yourself the opportunity to explore, be curious. Slide in people's DMs. You can slide in mine. I'll answer any question that you may have, but just never stop being curious and always be open to opportunities.
Absolutely. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I would say there's value in community building, learning those skills, learning how to build those relationships. That's what helps community health work anyway. What I'm learning is that people don't really care about the organization. They care more about the person they're working with. If they like you, they will go for bat for you. Something they would tell someone no, our organization would never donate this, or we would never do that. I've seen people done a lot more for people that they have a stronger relationship with. So do not underestimate that. And that's a very important skill in community health. We all need each other. Do not work in silos.
Great advice. Number 3, what's something you're working on improving in your life right now?
I would say I feel like I'm doing better with time management, but I need to do even better. I need to start scheduling time just for me to watch TV or just watch a Netflix show, or, just do something for fun. I feel like I'm in a very, I don't know, prime moment in my life. Like, there's just so many great things going on. But then I'm also just, just making sure that I make time just to relax and not feel bad about it.
Yeah, absolutely. I definitely feel what you're feeling there.
Yeah.
So yeah. Number 4, professionally, do you recommend anything?
Yes, I listen to What the Health podcast. That's pretty interesting. I think the book that really changed my outlook on public health is Medical Apartheid by Harriet A. Washington. That was a really good read that helped me understand, like, okay, so it's not just Tuskegee that they keep bringing up. There's just so many other instances, and that helps me speak to these points. Like, when I'm at the table and they're asking, well, why don't people want to get the vaccine? And it's like, it's so much more, right?
Yeah.
How much time do I have?
Yeah.
So I think that book was life-changing. I always suggest people to read that.
Okay. And do you listen to any podcast or any things on like the entrepreneurial side that you would recommend?
There's like a Side Hustle. Oh gosh, I can't remember the Side Hustle on the Go.
Oh yeah. I know that one.
Yeah, Side Hustle on the Go is pretty good. And Myleik Teele, her podcast is pretty great. She's the founder of Curlbox, and she started it with no real idea on how to scale it or anything. It just kind of worked. She was one of the very first subscription boxes. And then now almost everyone has a subscription box. So she was one of the first to ever do it. And her podcast is really helpful. She talks about, even building your self-confidence at work. Because imposter syndrome is real. No matter how much, education you have, that's always something that can creep up and make you wonder, do I belong in this room or not? So.
Yeah, awesome. Thank you for sharing those. And last but not least, where can people connect with you?
You can connect with me on Instagram, Black Health Commission, or my personal Instagram, King_Desir. And you can also email me, rebecca.desir@gmail.com. I can answer any questions that you have, or even if you're not interested in what I'm doing, I'm sure I know someone that is doing what you're interested in. So please feel free to reach out to me and just ask questions.
Yeah, awesome. Well, thank you so much for taking time to be on the show today. I know that people definitely are going to find a lot of useful information in your story and your insights. So I appreciate you doing this for me.
Awesome. Thank you. Thank you so much.
Yeah, my pleasure.
Well, I'm really glad to have had Rebecca on the show today. I know she dropped some gems. She really showed us, walked us through her story, her public health path, why she decided to start a nonprofit, how she's going to expand on that, the work that they are doing, and just different things. She definitely talked about some tips for LinkedIn and different things like that. And I think this episode is definitely useful if you are starting on your public health journey or you want to get into like the public health entrepreneurship. There's a lot of space for this kind of work out there. So I hope you enjoy, and definitely don't forget to subscribe, leave a review, Like, comment, share. I appreciate you all. And you all will see me next week. Take care. Public Health Millennial out.